Are you starting to experience hormonal fluctuations and maybe you're having some hot flashes or your anxiety is going up a little bit? Maybe you've had some weight gain. And this is something you expect maybe in middle life, but are you also experiencing other symptoms and you're not so sure if they're hormonally related? Do you feel like you're asking yourself the question, is this normal, more often than not? Hi, I'm Sherry, and I'm a menopause health coach, and I work with smart and independent women just like you. And through holistic methods, I can help you get comfortable in your skin again, regain your energy, your confidence, and your joy for life, so you can rock a cute pair of jeans. Now, officially, there are 34 recognized menopause symptoms. Some of them are a little bit better known than others, and I just wanted to talk with you today about 4 that you may not realize are related to our changing estrogen levels. The first one that I wanted to tell you about is dental issues. So one of the important roles that estrogen plays in our body is really helping us maintain hydration and moisture. And so when you think about your mouth, that needs to stay moist. And as our estrogen declines, it's possible that your mouth may feel drier. And if this happens, it really opens you up for increased risk of gum disease and tooth decay. Another thing that declining estrogen opens us up for is a higher risk of osteoporosis. Now, it's always easy to think of osteoporosis affecting, maybe like your hips or larger bones. But when you think about our jaw, that's also a bone. And so we can ultimately get osteoporosis in our jaw. Another issue that is estrogen related is our digestion. So estrogen does play a role in our digestion, and one of the things that it aids in is helping the liver release bile. And as we get older, and if we're releasing less bile, this is actually leading to the possibility of increased risk of constipation. The other thing that this declining estrogen can do with our digestion is it can actually increase water retention. So this is where you're going to start feeling a little bit bloated. The other issue with digestion and estrogen is it actually changes the way we're going to metabolize carbohydrates and proteins. And again, this can cause gas and bloating. The third thing I wanted to talk about, it's a little embarrassing, it's a little personal, but body odor. So the hypothalamus, which helps regulate our body temperature, is of course helped by, you guessed it, estrogen. And so as the estrogen starts to decline, the hypothalamus gets a little lost and doesn't do such a great job at temperature regulation. This is where our hot flashes and night sweats come from. But then what also starts to happen is because we're getting these hot flashes and night sweats, we're sweating a lot more. Now here's the interesting thing is when you sweat, say from exercise, it's a little stinky, but it's kind of like normal stinky. But when you're sweating because of increased anxiety or stress, it actually has a whole nother level of funk to it. So that is something to be very, very aware of. And I think a lot of people but women get caught off guard when this happens to them. And then also, again, really kind of personal, but is again with estrogen and moisture, it can lead to vaginal dryness, which also can add to this body odor issue. So I know just these first three are enough to make your head spin, but we're going to close out with the fourth one, which is dizziness. So some women do experience dizziness as they're going through perimenopause, and this is linked to a couple of things. So as we're going through perimenopause, we're experiencing hot flashes, we're experiencing maybe panic attacks, increased stress and anxiety. And all of those things can actually trigger dizziness. Another thing that can trigger dizziness is, again, as the estrogen declines, we don't have that heart protection that we did when we were younger. And as that opens us up for more cardiovascular risk, that can also attach itself on to dizziness. So I feel like that this is a lot. And estrogen, I think you can see how vital it is to really maintain how well you feel. And if you would like to do something to balance your hormones in a more holistic, natural way, then I really invite you to book a Makeover Your Menopause Discovery call with me. And it's just a free 45-minute chat, and it'll really give you a chance to see what's possible. So go ahead, and I will have the link in the comments, and I hope you really found this little chat we had helpful. So peace and love.